As we age, the way our body absorbs and utilizes nutrients changes dramatically. This is particularly true after the age of 60, when the gastrointestinal system, hormonal balance, and cellular repair mechanisms begin to slow down or alter in function. The first key to understanding how to take supplements like magnesium, vitamin D3, and K2 correctly lies in knowing the neuroscience behind nutrient absorption in older adults. Nutrient absorption doesn't just depend on what we take, but also on how our body processes it, and that's a neurological and biological process, not just a digestive one. In younger individuals, the gut lining, enzyme production, and neurochemical signaling are efficient, meaning that the body recognizes what's ingested and knows how to distribute it effectively to the areas that need it. In seniors, however, several barriers appear. For example, gastric acid levels typically decrease with age, and this alone can impair the breakdown of minerals like magnesium and the conversion of vitamin D3 into its active form. Without sufficient stomach acid and digestive enzymes, the absorption of fat-soluble vitamins like D3 and K2 becomes inefficient. The neuroscience component here involves the enteric nervous system, the second brain in the gut, which is responsible for regulating digestion and nutrient transport. As this system weakens with age, the brain-gut communication becomes disrupted, which may lead to poor nutrient signaling and absorption. The decline of dopamine and serotonin levels, two critical neurotransmitters, not only affects mood and cognition, but also the regulation of appetite and digestion. Dopamine in particular is associated with reward and motivation, but also stimulates certain digestive responses. Low dopamine in seniors can mean lower stimulation of digestive processes that facilitate the breakdown and absorption of nutrients. In other words, even if a senior is taking magnesium or D3, their body may not be neurologically primed to use it effectively. Another factor tied to brain signaling is the vagus nerve. This major communication highway between the brain and the digestive organs regulates processes like peristalsis, the movement of food through the digestive tract, enzyme release, and bile production. In older adults, vagus nerve tone can decline, slowing down these processes. Reduced vagal activity leads to slower gut motility, more bloating, constipation, and ultimately poor absorption of essential nutrients. So the nutrients sit in the gut longer or are flushed out before they are even absorbed properly. Aging also impacts the brain's hypothalamic regulation of hormones. The hypothalamus, a region of the brain deeply involved in endocrine control, modulates everything from metabolism to calcium balance through hormone signaling. For example, if a senior is taking vitamin D3, the body must convert it in the liver and kidneys into its active form, calcitriol. This process is regulated by parathyroid hormone and involves tight communication between the hypothalamus, pituitary gland, and peripheral organs. If the brain is not signaling these organs correctly due to age decline, even high doses of vitamin D3 may not translate into real benefits for bone or immune health. Magnesium, which is involved in over 300 enzymatic reactions in the body, also depends on proper neurological function for optimal usage. It's a cofactor in ATP production, nerve transmission, muscle contraction, and even sleep regulation. However, the body doesn't just absorb magnesium because it's present in the bloodstream. It must be drawn into the cells. This process is governed by ion channels, which are tightly controlled by electrical signals and neurotransmitters. As these systems slow with age, cellular uptake of magnesium becomes less efficient, even if blood levels appear normal on a lab test. Neuroscience research also shows that older adults tend to have reduced receptor sensitivity to certain nutrients and hormones. That means even if magnesium or vitamin D3 reaches the target tissue, the cells may not respond as strongly as they would in a younger individual. This resistance requires precise balancing and sometimes cofactors like vitamin K2 or boron to activate those pathways. Without proper neurological feedback loops, the nutrient cascade doesn't trigger as intended, leading to underwhelming results or unintended side effects. The blood-brain barrier, which protects the brain from toxins and regulates the passage of nutrients, also becomes more permeable with age. This increases the likelihood of neuroinflammation when the balance of supplements is off. For instance, excess magnesium or vitamin D3, if not properly absorbed, can accumulate or get metabolized inefficiently, triggering inflammatory cytokines. This not only affects the gut and bones, but also leads to cognitive fog, fatigue, and mood disturbances, commonly mistaken for aging symptoms. The microbiome plays a critical role here as well. Beneficial gut bacteria help synthesize certain B vitamins and assist in the activation of K2, but they also communicate directly with the brain through the gut-brain axis. Dysbiosis, or microbial imbalance, which is common in seniors due to years of antibiotic use, poor diet, or stress, can impair this signaling. When the microbiome is out of balance, it sends distress signals to the brain, activating the sympathetic nervous system and leading to chronic low-grade inflammation. This inflammation disrupts nutrient absorption and heightens the risk of deficiency, even when supplementation is consistent. Finally, seniors are more likely to have pre-existing neurological conditions or take medications that alter brain chemistry, further disrupting nutrient signaling pathways. Antidepressants, anti-anxiety drugs, and even over-the-counter medications like antacids can dull the nervous system's responsiveness and inhibit enzymes essential for converting and transporting nutrients across cellular membranes. All these interferences suggest that supplementation without addressing the neurological and physiological foundation of absorption can lead to wasted effort, money, and even harm. When it comes to supplementing with vitamins like D3 and K2, especially for seniors, the focus is often placed on dosage. However, the often overlooked factor that plays a crucial role is timing. The body operates on circadian rhythms, biological processes that follow a 24-hour cycle and regulate everything from hormone secretion to cellular repair. These rhythms also govern nutrient absorption, enzymatic activity, and metabolic function. For seniors whose circadian rhythms often become disrupted with age, aligning supplement intake with the body's natural cycles becomes even more critical for effectiveness and safety. Vitamin D3, for instance, is closely tied to sunlight exposure and melatonin production. Taking it at the wrong time can disrupt sleep patterns or impair absorption. Morning is generally the most optimal time for taking vitamin D3 because it mimics the body's natural production through sun exposure. D3 is fat-soluble and requires the presence of dietary fat to be absorbed properly. If taken without food or in the evening, its bioavailability drops significantly. Moreover, D3 can slightly increase energy and alertness because of its relationship with serotonin and dopamine pathways. Taking it too late in the day, especially in seniors who already struggle with sleep, can suppress melatonin and disturb the sleep-wake cycle. This is particularly concerning as poor sleep has a compounding effect on overall health, impairing immune function, brain health, and even how nutrients are processed the following day. Vitamin K2, on the other hand, works synergistically with D3 to guide calcium into the bones and teeth instead of arteries. But its activity is not constant throughout the day. Studies have shown that K2-dependent proteins like osteocalcin and matrix GLA protein are synthesized in greater quantities during late morning and early afternoon hours. This means that taking K2 alongside D3 in the morning, preferably with a fat-consuming meal, maximizes its function. In other words, when both indigestive and/or stomach acid production is down, matrix G2 inhibitors, like magnesium, predict more deep sleep and reduce. Seniors who take K2 in the evening or sporadically throughout the week may not be timing the supplement with the body's calcium-regulating mechanisms, potentially increasing the risk of arterial calcification or weakening bone structure despite supplementation. Magnesium, another essential mineral, adds another layer of complexity to this equation. It supports over 300 enzymatic reactions in the body, including the conversion of vitamin D3 into its active form. However, magnesium has a calming effect on the nervous system and can promote sleep when taken in the evening. This leads many people to assume that combining it with D3 and K2 is convenient and effective, but this can be misleading. When D3 is taken with magnesium at night, there is a potential clash in neurological signaling. D3 may stimulate wakefulness, while magnesium encourages relaxation. For seniors who already experience fragmented sleep, combining these at the wrong time can confuse the body's neurochemical signals. Another timing factor is related to medication interactions. Many seniors take prescriptions like blood thinners, antihypertensives, or cholesterol medications, which operate on strict pharmacokinetic timelines. Vitamin K2 in particular can interact with anticoagulant medications such as warfarin by affecting blood clotting mechanisms. If taken too close to these medications, it may either weaken or amplify their effects, depending on the timing and dosage. Understanding when the medication is metabolized and aligning supplement intake to avoid overlaps is essential for both safety and efficacy. Without professional guidance on timing, the risk of unintended interactions becomes higher. The body's insulin response also influences how well certain nutrients are absorbed. For example, meals consumed early in the day, especially those with healthy fats, trigger better insulin sensitivity and bile production, both of which enhance the uptake of fat-soluble vitamins like D3 and K2. In contrast, insulin resistance tends to increase in the evening, particularly in older adults. Taking these vitamins late in the day, especially on an empty stomach or with a low-fat meal, may significantly reduce their absorption. Additionally, nighttime digestion is generally slower, which may prevent these nutrients from being properly broken down and utilized. Cortisol levels, which peak in the early morning and gradually decline throughout the day, also play a role. Cortisol is a stress hormone, but also a regulator of inflammation and metabolism. High morning cortisol levels can actually enhance nutrient mobilization and absorption. This natural biological state makes morning an ideal time for taking D3 and K2, as their effects are amplified by the heightened metabolic activity. Conversely, low cortisol at night signals the body to slow down, making the system less responsive to nutrients introduced at that time. The liver's detoxification pathways, which are largely responsible for converting D3 into its usable form, are most active during the early part of the day. For seniors whose liver function may already be compromised or slower, aligning D3 intake with peak liver activity ensures that it doesn't sit inactive or create a bottleneck in the system. Similarly, K2's action on calcium transport depends on liver-generated proteins that follow a daily cycle, further highlighting the importance of strategic timing. Meal composition throughout the day is another aspect that ties into timing. Seniors often consume lighter meals in the evening, which are low in fats and fiber, both essential for the absorption of D3 and K2. If these supplements are taken during or after such meals, the absorption may be incomplete or negligible. In contrast, a well-balanced breakfast or lunch, including healthy fats like avocado, olive oil, or eggs, provides the necessary environment for fat-soluble vitamins to be absorbed efficiently. Skipping meals or poor nutrient pairing during supplement intake time can further degrade efficacy. Finally, the psychological and neurological benefits of properly timed supplementation are significant. Seniors who take D3 in the morning often report improved mood, energy, and cognitive clarity throughout the day. This is because D3 stimulates the synthesis of serotonin, a neurotransmitter associated with happiness and mental focus. Taking it at night may blunt these effects or cause restlessness. Likewise, K2 supports vascular flexibility and bone health, but only if the body's internal systems are active and aligned to distribute it correctly. Timing supplements to match these cycles is essential for optimizing the aging body's capacity to heal, repair, and maintain resilience. Magnesium is often celebrated as one of the most essential minerals for human health, playing a vital role in muscle function, bone strength, nerve communication, and energy production. However, what is rarely discussed, especially among seniors, is the impact of unbalanced magnesium levels on the aging brain. The brain is an electrically active organ that requires finely tuned mineral levels to operate properly. Magnesium is a key regulator of ion channels that control electrical impulses, neurotransmitter release, and synaptic activity. When magnesium levels are too low or even too high without proper balance, the brain's electrical system becomes disrupted, leading to cognitive decline, mood disturbances, and heightened risk of neurodegenerative diseases. In seniors, the challenge lies not only in maintaining enough magnesium, but also in ensuring it is being absorbed, retained, and utilized efficiently within the brain. With age, the intestinal lining becomes less permeable to certain minerals, including magnesium. Compounding this, many older adults have a reduced ability to retain magnesium in their cells due to declining kidney function or chronic inflammation. Even those taking magnesium supplements daily might find their blood levels normal, but their intracellular magnesium, especially in the brain, is dangerously low. This discrepancy contributes to what neuroscientists refer to as silent deficiencies, which silently deteriorate cognitive function over time without showing up on basic lab results. The hippocampus, the region of the brain responsible for memory and learning, is especially sensitive to magnesium levels. Magnesium acts as a gatekeeper for NMDA receptors, critical sites for neuroplasticity and memory formation. When magnesium levels drop, NMDA receptors become overactive, flooding the brain with calcium and overstimulating neurons. This leads to excitotoxicity, a process that damages and kills neurons over time. Seniors already have a naturally higher risk of cognitive decline, and low magnesium simply accelerates this process by impairing the brain's ability to regulate excitation and inhibition. This imbalance is closely linked to conditions like Alzheimer's disease and age memory loss. Magnesium is also essential for the production of neurotransmitters like GABA and serotonin. GABA is the brain's primary calming neurotransmitter, and without sufficient magnesium, GABA activity drops. The result is increased anxiety, poor sleep quality, and even panic attacks. Symptoms often attributed to aging or psychological stress, but rooted in nutritional imbalance. Similarly, magnesium influences serotonin production, which is directly connected to mood and emotional regulation. Seniors with low magnesium often report feelings of sadness, irritability, or mental fatigue, mistakenly believed to be part of aging when they may be signals of neurochemical imbalance. Unbalanced magnesium levels don't just affect mood and cognition, they interfere with sleep architecture, which is a cornerstone of brain health. Magnesium helps regulate melatonin, the hormone responsible for sleep-wake cycles. When magnesium is insufficient, melatonin production is inconsistent, leading to fragmented sleep, shallow REM cycles, and nighttime waking. These sleep disturbances, in turn, impair memory consolidation and emotional regulation, creating a feedback loop of decline. Sleep-deprived brains cannot efficiently clear toxins like beta amyloid, which accumulate in neurodegenerative diseases. The long-term effect is a brain that ages faster with declining mental sharpness and resilience. In addition to low levels, excess magnesium, especially from poorly formulated supplements, can be problematic. High doses of certain forms, like magnesium oxide or magnesium sulfate, can overwhelm the digestive system, leading to diarrhea and electrolyte imbalance. But more critically, when not balanced with other minerals like calcium, potassium, and sodium, excessive magnesium can alter nerve signal transmission. And so the brain relies on delicate ratios of these minerals to maintain action potentials and synaptic communication. A magnesium overload without counterbalancing nutrients can lead to confusion, mental fog, and muscle weakness, which are often misdiagnosed as signs of aging or medication side effects. For seniors already on medications such as diuretics, proton pump inhibitors, or blood pressure drugs, the risk of magnesium imbalance increases. Diuretics, for instance, cause the kidneys to flush out essential minerals, including magnesium. Proton pump inhibitors reduce stomach acid, which is necessary for magnesium absorption. This creates a compounded problem. Supplements are taken with good intent, but the body is physiologically unable to absorb or retain them properly. Over time, the brain's performance suffers, and the individual may experience difficulty concentrating, short-term memory issues, and a decreased ability to handle stress or emotional changes. Chronic inflammation, which becomes more prevalent with age, also plays a role in how magnesium functions in the brain. Inflammatory cytokines can interfere with magnesium transport across the blood-brain barrier, meaning that even if magnesium is present in the bloodstream, it doesn't necessarily make its way into brain tissue. This is why seniors with systemic inflammation often report brain fog or sluggish thinking. Their brains are starved for magnesium despite normal intake. This form of functional deficiency is subtle but destructive, weakening neural pathways and diminishing the brain's capacity to adapt and learn. Another overlooked issue is the form of magnesium taken. Not all forms are bioavailable or brain-friendly. For example, magnesium threonate is specifically designed to cross the brain barrier and increase brain magnesium levels, while others, like magnesium citrate or glycinate, are more focused on muscle relaxation or digestive support. Seniors often take whatever form is available without understanding its targeted effect. This means that although they may experience physical benefits, like reduced cramping or improved bowel movements, their brain may continue to operate under a cloud of low magnesium, impairing their cognitive and emotional well-being. As people age, their likelihood of taking multiple medications increases, and this reality introduces a complex layer when it comes to supplement use. Magnesium, vitamin D3, and vitamin K2 are often recommended to support bone, heart, and brain health in seniors, but their interactions with commonly prescribed medications can create serious complications if not properly managed. These interactions aren't always obvious and can be either synergistic or antagonistic, depending on the timing, dosage, and the individual's unique physiology. Seniors are particularly vulnerable to these effects because their bodies are less efficient at metabolizing both drugs and nutrients due to age changes in liver and kidney function. One of the most important interactions occurs between vitamin K2 and anticoagulant medications such as warfarin. K2 plays a critical role in blood clotting because it activates proteins that help regulate calcium deposition in blood vessels and bone. Warfarin, on the other hand, works by inhibiting the vitamin K dipapate clotting pathway to prevent unwanted blood clots. If a senior takes K2 alongside warfarin without medical supervision, it can counteract the drug's intended effect, increasing the risk of blood clots, strokes, or bleeding complications. Adjusting warfarin dosages in patients who take K2 requires careful monitoring, and sudden changes in K2 intake can dangerously disrupt blood coagulation balance. Magnesium also has significant interactions with cardiovascular medications, especially calcium channel blockers and certain diuretics. Magnesium acts as a natural calcium channel blocker, helping to relax blood vessels and regulate heart rhythms. While this can be beneficial, taking it alongside prescription calcium channel blockers can lead to an additive effect, resulting in excessively low blood pressure or bradycardia. For seniors with already low baseline blood pressure or heart rate issues, this interaction can cause dizziness, fainting, or arrhythmias. Similarly, diuretics, often prescribed for high blood pressure or heart failure, can deplete magnesium from the body, leading to a deficiency that exacerbates symptoms such as muscle cramps, fatigue, or irregular heartbeat. This creates a feedback loop where a supplement meant to restore balance may conflict with a medication that depletes or mimics its action. Vitamin D3 interacts with several classes of medications, including corticosteroids, weight loss drugs, and cholesterol-lowering agents. Corticosteroids like prednisone can reduce calcium and vitamin D levels, leading to bone thinning over time. Seniors taking corticosteroids are often prescribed D3 to counteract this effect, but without monitoring, they may still fall short of the required absorption threshold. Fat-blocking weight loss medications like orlistat can impair the absorption of fat-soluble vitamins, including D3 and K2. This can lead to deficiencies even if a senior is taking supplements regularly. Cholesterol-lowering statins can interfere with the production of vitamin D in the body, since vitamin D is synthesized from cholesterol. When statins lower cholesterol too aggressively, vitamin D production may decrease, causing unrecognized deficiency unless supplementation is carefully calibrated. Seniors also commonly take proton pump inhibitors for acid reflux, which can interfere with magnesium absorption. If you produce more magnesium, or these drugs reduce stomach acid, which is necessary to ionize magnesium salts so they can be absorbed in the intestine. Over time, this may lead to magnesium deficiency even when taking supplements. This is particularly dangerous because low magnesium can lead to muscle weakness, cramps, and neurological issues like confusion or tremors, which may be mistaken for aging symptoms. The longer these drugs are used, the more profound the malabsorption becomes, making supplementation less effective unless underlying causes are addressed. Antibiotics can disrupt the gut microbiome, which is essential for the synthesis and activation of certain vitamins, particularly K2. The microbiome plays a role in converting K1 into K2 and in maintaining a healthy gut lining for optimal absorption. The very best treatment for HIV is also the very best antibiotic. The best treatment for healthy vitamins is maintaining a healthy gut lining for optimal absorption. Broad-spectrum antibiotics not only kill harmful bacteria, but also the beneficial strains that contribute to nutrient activation. This disruption can lead to decreased efficacy of supplements, especially those that depend on microbial processing. Seniors taking antibiotics regularly or long-term are at particular risk of undermining their own supplement regimen without realizing it. Even common over-the-counter medications such as antacids and laxatives can create conflicts. Antacids reduce stomach acid and impair the absorption of both magnesium and vitamin D. Laxatives, particularly stimulant types, can speed up gastrointestinal transit time, reducing the time available for nutrient absorption. Seniors who rely on these medications to manage digestive discomforts may be unintentionally flushing out supplements before their bodies have the chance to absorb them. Over time, this leads to persistent deficiencies that are not addressed simply by increasing supplement dosages. Polypharmacy, the use of multiple medications simultaneously, increases the complexity of supplement management. Each drug may affect a different metabolic pathway or organ system involved in nutrient absorption or utilization. For example, medications that burden the liver or kidneys may impair the activation or excretion of vitamin D3 or magnesium. When the body's detoxification and regulatory systems are already under pressure, introducing high doses of supplements can become more of a burden than a benefit. It's not uncommon for seniors to take magnesium for sleep, D3 for bones, and K2 for arteries, while also using sleep aids, blood pressure medications, and cholesterol drugs, all of which can interfere with or mask the real effectiveness of the supplements. There's also the issue of competitive absorption. When multiple supplements and medications are taken together, they may compete for the same transport mechanisms in the gut or bloodstream. Magnesium, calcium, and zinc often share similar absorption pathways, and an overload of one can suppress the uptake of the others. Seniors who take high doses of magnesium may unknowingly impair their calcium balance, or vice versa. Similarly, some medications use the same hepatic enzymes as supplements for metabolism. This can delay or alter how either substance is processed, leading to reduced efficacy or increased risk of toxicity. Many seniors take supplements such as magnesium, vitamin D3, and K2 without realizing that their bodies might be rejecting these nutrients in subtle, silent ways. Unlike acute symptoms that arise immediately, nutrient rejection often manifests through slow, chronic issues that are mistakenly attributed to aging. One of the most common signs that a senior's body is not accepting these supplements effectively is persistent fatigue. Despite taking D3, which supports energy and mood, many individuals still feel chronically tired. This often occurs because the vitamin is not being properly converted into its active form or absorbed due to digestive inefficiencies or liver dysfunction, both of which become more common with age. Another overlooked sign of nutrient rejection is digestive discomfort, such as bloating, cramping, or loose stools shortly after taking magnesium. This is especially true when the form of magnesium is not well suited to the individual's digestive system. Forms like magnesium oxide or citrate can act as laxatives, leading the body to purge before absorbing any real benefit. Seniors with sensitive digestive systems or compromised gut linings may find their intestines reacting defensively to supplementation. The body essentially identifies the compound as foreign or irritating rather than nourishing. This is not an allergy, but a form of biochemical rejection that reduces overall nutrient uptake. Joint stiffness and muscle cramps can also indicate that magnesium or vitamin D3 is not being utilized correctly. Magnesium plays a direct role in muscle relaxation and nerve function. When intracellular levels remain low despite supplementation, it often means that the nutrient is not making its way into the cells where it is needed. This points to an issue with cellular transport, receptor sensitivity, or cofactor deficiency. For instance, magnesium depends on adequate vitamin B6 and ATP to enter cells. If either is lacking, magnesium may float in the bloodstream without ever reaching its intended destinations. The same applies to vitamin D3, which requires magnesium for its conversion and utilization. If magnesium levels are low or poorly absorbed, D3 supplementation becomes ineffective regardless of the dosage. Mood fluctuations, depression, and irritability can also signal the body's rejection of these nutrients. Magnesium and D3 both support neurotransmitter function, particularly serotonin and dopamine. When the brain remains low in these chemicals despite regular supplementation, it could mean the nutrients are not crossing the blood-brain barrier or are not being activated in the liver and kidneys. Seniors with chronic inflammation or oxidative stress may have disrupted transport systems that prevent nutrients from reaching neural tissues. This situation creates a paradox where someone is supplementing daily but still feeling emotionally unstable, anxious, or fatigued. Another critical sign of nutrient rejection is abnormal lab results that persist or worsen even after months of supplementation. Blood calcium may rise unexpectedly while bones continue to weaken, suggesting that D3 is increasing calcium levels in the blood, but without K2, that calcium is not being directed to the bones. Instead, it may begin to deposit in soft tissues, including arteries. This is one of the most serious forms of nutrient mismanagement. The presence of one nutrient without the complementary cofactors can cause imbalances that lead to long-term damage. In this case, the body is not only rejecting the nutrient, but redirecting it in a harmful way. Skin issues such as rashes, dryness, or breakouts after taking supplements can also be a clue. The skin is a major detoxification organ, and when the liver is overwhelmed or the gut is leaky, the body may attempt to expel unprocessed nutrients through the skin. This detox response can happen when the supplement form is synthetic, too concentrated, or incompatible with the individual's metabolic profile. Seniors are especially vulnerable to this because their detoxification systems are often slower and their tolerance thresholds are lower. What appears to be a skin allergy might actually be the body's signal that it's not able to metabolize or store the nutrient efficiently. Cognitive fog or lack of mental clarity can indicate that magnesium and D3 are not doing their job in supporting neural communication. Inflammation in the gut or blood-brain barrier may block these nutrients from accessing brain tissue. Over time, this leads to reduced synaptic function and poor neuroplasticity. Seniors may notice slower recall, trouble concentrating, or even mild disorientation that doesn't improve with supplementation. This is often misattributed to aging, when it could be the result of a breakdown in the metabolic chain that activates and utilizes these nutrients effectively. Cardiovascular symptoms such as palpitations, irregular heartbeat, or hypertension can also be signs of improper nutrient utilization. Magnesium regulates electrical signals in the heart, and vitamin K2 helps prevent calcium buildup in arteries. When either nutrient is not absorbed properly or is imbalanced due to missing cofactors, the cardiovascular system suffers. Some seniors take high doses of D3 but lack K2, leading to calcification and stiff arteries. Others may take magnesium but not absorb it intracellularly, which means it doesn't regulate heart rhythm as intended. The symptoms that follow are not due to deficiency per se, but due to malfunctioning pathways of nutrient transport and utilization. Urinary changes such as frequent urination or cloudy urine may also indicate that the body is eliminating excess, unabsorbed nutrients. The kidneys play a vital role in filtering out what the body doesn't use, and when supplements are not effectively processed, they are flushed out, sometimes irritating the urinary tract in the process. This constant excretion without absorption leaves the senior both depleted and confused, wondering why the supplements are not delivering expected results. Changes in bone density or continued weakening of joints, even after consistent supplementation with D3 and K2, suggests that the nutrients are not reaching bone tissue. This can happen due to gut dysfunction, poor bile production, or insufficient levels of other synergistic nutrients such as magnesium, boron, or vitamin A. Seniors with digestive issues, gallbladder removal, or chronic liver disease are especially prone to this problem. The supplements may appear to be taken correctly, but the body silently rejects them through inefficient conversion, poor absorption, or lack of tissue uptake, ultimately leaving the system undernourished despite best efforts.